So today we're going to discuss prostatectomy. I have a lot of gentlemen who come to me and believe at different ages, right? Now prostatectomy can range from 45 to 50 and up. In the past the number was not that low, but that's okay. So the prostate was removed. The urologist and oncologist did a great job. Maybe you've gone through chemotherapy or radiation, and some of the people, the percentage really varies. They result with urinary incontinence. Very rarely, I want to say maybe 2% result in fecal incontinence, where there's unfortunately feces that are not being controlled. But let's talk about that later. We're going to talk about urinary incontinence post-prostatectomy. 36% of people really suffer with that. So gentlemen come to me wearing Depends. And I do have to say they're upset about it because they thought once the cancer is cut out, they go through all of their treatments, it's done. But now they have to come to pelvic floor therapy and deal with urinary incontinence. Some people wear Depends, some people will wear large pads, some people will line up Depends with pads, and some people are far gone away from prostatectomy. It's been years, they've done very well, but they're constantly dribbling. That's still urinary incontinence. So we address all aspects of it. Some people don't leak during the day, but they have to sleep on the pad at night. Some people never leak at night, but during the day with trunk rotation and lifting and maybe being exhausted at the end of the day, they start to leak. Some patients cannot initiate a stream to pee, even though they have an enlarged prostate. Some people can initiate, they pee, they put their clothing on, and they say partially some remaining in the bladder will come out. We call it a dribble. Dribble could be a couple of drops down to a couple of tablespoons. So as you could see, post-prostatectomy, urinary incontinence comes in these all different varieties. But don't worry, the good news, we got you. We know how to deal with that. Our goal is to take you from where you are now, and that's our baseline, right? And we have to determine what's causing your incontinence. And that's when the evaluation comes. And our goal is always, at the end of the day, is to get rid of all of the pads and including dribble. So when patients are graduating from this program, we say to you, do you have dribble? And you're like, no. Do you have dribble when you sit, stand, laying down, lifting, sleeping? At the end of the day, we give you all these different scenarios. If the answer is no, you graduate.